And we're going to use an RBC and we're going to trace it through this heart. All right, so we've got systemic blood coming into the inferior and superior vena cava. And the right atrium also has a coronary sinus. The coronary sinus is draining blood from the heart muscle tissue itself. So it's deoxygenated blood coming back to the right atrium. The inferior and superior vena cava drain the body of deoxygenated blood. The superior draining the upper half of the body, the inferior draining the inferior half. All right, once it enters the right atrium, it goes through an AV valve to the right ventricle. And that AV valve is a tricuspid valve that has tendae chordae that attach to papillary muscles in the right ventricle. And when the right ventricle contracts to shunt blood into the pulmonary trunk, the chordae tendineae hold the AV cusps closed so blood does not backflow into the right atrium. All right. The muscle on the interior of the right atrium is known as pectinate muscles. Pectinate muscles. Okay, so now we got blood into the pulmonary trunk. It left the right ventricle through a valve called the pulmonary semilunar valve. Went up into the trunk splits into the right and left pulmonary artery that goes to the lungs. The blood returning from the lungs is oxygenated, goes through the pulmonary veins into the left atrium. From the left atrium, it goes through an AV valve again into the left ventricle. That AV valve also has chordae tendineae that hold it closed when the left ventricle contracts. From the left ventricle, the blood is shunted through the aortic semilunar valve into the aorta. The aorta expands and then contracts. That's known as elastic rebound. And that elastic rebound will help shunt blood not only into the system, but into the coronary arteries that feed the myocardium of the heart. Electrically, it's stimulated from the SA node to the AV node to the bundle of His to the bundle branches. The bundle branches lie in the ventricular interseptum or interseptum of the ventriculum muscles. And then it goes to the Purkinje fibers that innervate the ventricular myocardium. And that's it in a nutshell. We traced our RBC.
Yeah, that way you have a little.
Okay.
Okay, so what would you want us to ID on the inside of this?
Well, what I was telling them, what I would do is, well, you can tell the chordae tendineae. So you know if there's a pin there, I mean, that's quite obvious. I might say, what are they attached to? And you can say AV valve. If it's on the left side, it's the mitral. If it's on the right side, it's the tricuspid. All right? Now, if I take my probe and I put it in a vessel and it comes down to the heart, what you would look for is to see where it winds up in the heart. So let's say, for argument's sake on this, it winds up in the left ventricle. So you know it has to be one of two things. It has to be blood coming back from the heart, or blood coming from the left atrium into the ventricle, or it has to be blood leaving the ventricle out into the system. So what I would do is put a card there and say, name the structure that carries blood from the left ventricle to the system. And you would say aorta. Or if I said blood is coming from this structure to the left ventricle, you would say the left atrium. Okay? So that's how I would do it. Because again, these aren't exactly the same in structure as our hearts. So, got to give you some hints to get through it.